So, for our nursing theory project, we chose the environmental model by Florence Nightingale, and this was made by Kaylee Schmidt and Wesley K. Monroe.
Florence Nightingale, born in 1820 and passed away in 1910, was a prominent figure in nursing history. She's known as the Lady with the Lamp and was an advocate for improving healthcare systems, and she also advocated for the professionalization of nursing. Most famous for the Crimean War, where she reduced the death rates of soldiers with a team of nurses, and she developed a new theory of nursing, the environmental theory, which has 5 key factors to ensure the promotion of health and well being for a patient.
The background of Florence Nightingale. So, Florence Nightingale's family had forbid her from pursuing nursing, and this is because at this time, nursing wasn't considered what it is today. It wasn't considered professional. Nurses were considered ignorant and drunken, but in 1851, Florence Nightingale went against her family's wishes and began her work in hospitals in Germany. And she completely changed the way the profession of nursing is viewed. The Crimean War and the start of the environmental theories. So it wasn't really until this war that the environmental theory was discovered by Florence Nightingale. Um, there were such unsanitary conditions that the mortality rate was around 40%. And then Florence Nightingale noticed a correlation between environmental conditions and patient health. And after environmental reforms, considering her environmental theory, the mortality rate dropped to 2.2%. After the war ended, Nightingale released her Notes on Nursing in 1859, and this contained the environmental theory that she founded during the war.
Florence Nightingale's environmental theory continues to guide healthcare to provide the best environment for patients. The basis of her theory is that a patient's environment affects their healing process. A nurse's responsibility is to promote a healthy environment and promoting health, not just treating their illnesses. There are 5 environmental factors to Florence Nightingale's theory. Carla Logan in Florence Nightingale's Nursing Theory and Its Significance in Contemporary Nursing defines them as the following: ventilation, which is proper air circulation to maintain a fresh and clean environment and help prevent the spread of airborne illnesses; cleanliness, which promotes health and prevents spread of infection or other illnesses; light can help reduce depression and help promote good sleep; noise reduction, loud or excessive noise can be overwhelming for patients, so nurses should reduce noise levels to ensure a peaceful environment; and lastly, nutrition, which means that a good diet is crucial to healing and promoting recovery.
Application in a clinical setting. Nightingale's environmental theory sheds light on some of the ways care is specialized within nursing today. Cleanliness is single-handedly the most important way of preventing infection today, as it was back then when she discovered this. The environment of each and every patient impacts their care. Cleanliness, nutrition, temperature, ventilation, and light all play a role in care outcomes, and Florence Nightingale knew this, and her environmental theory continues to play a role in the clinical setting of nursing today.
Personal philosophy of nursing. How does Nightingale's theory differ from our personal beliefs of nursing? Nightingale's theory includes 5 environmental factors: ventilation, light, cleanliness, noise reduction, and nutrition. For us, the environment also includes the emotional state of the patient, not just their health, but their mental state and their comfort level. The bond with the nurse, which is the connection and patient centered care. A nurse should be compassionate and listen to the patient attentively. The support group of the patient, meaning their family or whoever they have to support them. And lastly, their cultural surroundings. How do they perceive health and illness so that we as nurses can respect that and give the patient centered care that they deserve? Each patient is different and needs to be treated so.
So, how does our personal philosophy tie into Nightingale's environmental theory? Well, we're continuously learning and striving to achieve an even higher quality of patient care. We're understanding how important individual patient care is to health outcomes, and we're upholding the professionalism and honor to the professional nursing practice. And These are things that Florence Nightingale brought along with her in her environmental theory.
In conclusion, Florence Nightingale's environmental theory has been a stepping stone for current nurses and will continue to affect the future as we expand on her ideologies and find the best way to provide and care for our patients. In the past, Florence Nightingale helped build a theory for nurses to alter the environment of her patients to promote health and well being. Today, nurses strive to be able to give the best care possible for their patients in a clinical setting and understanding the importance of the patient environment. Adding on to Florence's theory, which is now considered the first steps to ensuring a good patient centered environment. In the future, us as nursing students will develop our own personal philosophy of nursing from the past and present so we can continue giving the utmost care to our patients and continue to strive for better ways to develop patient centered care and promoting health and well being. Because as healthcare is changing, expanding, and growing every day, we should as well.
Thank you for listening to our project about Florence Nightingale's environmental theory, and here are our references.